Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum to all our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host, Fahad Matin, for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that we all had a nice and positive week so far and looking forward for a nice and chillaxing weekend. This program is broadcasting live from the studios of Inspire FM today on 21st of November 2024, and the time just past 6 p.m. We're casting our positive vibes to all our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpenden and Bedford. Our airways reaching to our listeners through Inspire FM radio, our Inspire FM app, website, and you can view us live via Facebook live link and YouTube channel. If you're listening to the show on Thursday or any other Sundays, that means it's repeat. Hey ho, today is not a repeat show. It's Thursday, 21st of November. As we always say, prevention is better than cure, and definitely the winter has arrived. Yes, indeed. We have the chilliest evenings now and days. We had a bit of a snow day before yesterday, and it has changed our weather in a very nice and positive way, or chilliest way you can, whichever way you think, or you can see the whole thing. It is always nice to have something chills in our life. Yes, indeed. But as I said, the winter has arrived. And when winter has arrived, we normally take precautions. We normally cover ourselves. We normally go to different lengths to make sure that us and our loved ones are covered. We wrap ourselves up in nice warm clothes. We eat nice hot meals. We normally have hot drinks. And we make sure that our house is nice, lovely, warm weather. So we do not feel the cold and the chills outside. But then again, there are other things which we can do to safeguard us and our loved ones by having some winter vaccinations. Yes, indeed, we are talking about winter vaccinations. And you will be pleased to know that I'm not the one who will be talking about on this topic. I will be the one who's posing all the necessary questions from you guys to our two lovely, lovely guests today with me in the studio. And they are none other than, they are from Public Health England and their vaccination team. And they are Hannah and Louise. Good afternoon. How are you guys?
Very good. Thank you so much for having us here.
Thank you so much for coming to our show. So, as the tradition passes through, I always ask my guests to give a quick introduction about themselves and something about themselves which brought them into this lovely field of medicine. What brought you into the field of medicine? What is your expertise and how you're dealing with this particular topic? So, let's start with you, Hannah. Give us some bit of information about yourself.
Yeah, so I'm Hannah. I'm a specialty registrar in public health. I'm working in the Immunisations team in NHS England. And yeah, I suppose what brought me to this role is just a real passion for helping people to stay healthy. Like you say, prevention is better than cure, and that's what public health is all about. So it's really great to have the opportunity today to talk about winter vaccinations, a really great way to prevent people from getting sick in the first place.
Indeed. Yes, indeed. Sorry, Hannah, your full name is Hannah?
Roscoe.
For Hannah Roscoe. Sorry, I really do not want to mispronounce your last name, so I thought it's better not to say it. And let's introduce our second guest for the evening. And our second guest is Louise.
Hello, lovely to meet you all. My name's Louise Catling. I'm also a specialty registrar in public health, and I work in the NHS screening and immunisation team for the East of England, so we cover the whole region. My background's actually, I'm an ex-academic researcher, so I have a PhD in environmental epidemiology. That's studying the patterns of disease in populations and how the physical environment can influence those. And I think that's how I really got into it, like studying these patterns of disease. Why do certain population groups have higher rates of disease? Why can it vary across geographies? And what can we actually do about that? And public health is very much the next step. It's like, what can we do to address those inequalities as well?
Wow. And how long are you doing this?
Oh, don't ask. Very, very long time.
So that means during the COVID time, you were absolutely busy.
Yeah, we both were. So yeah.
Wow, good to know. Good to know. So as my intro suggested, that this is a winter vaccinations program, and one of the biggest problem which people do think, and they normally do not realize, and they normally ask, why is it important for getting vaccinations in this winter, and why the old people, why the older generations want vaccine in this particular winter?
That's a really good question. I think so. What Hannah and I will do today with yourself and your audience is to talk about the key population groups that are high risk. So they're the ones we really target for these vaccination campaigns, of which older people are one. So by older people, we mean anyone that's aged 65 years and above. And the reason that we offer, the NHS offers these free vaccinations is because older people are at increased risk of both picking up the bugs, but also having a more severe illness if they do get infected with either flu or COVID. So there's three that I'll talk about today: flu, COVID, and RSV that we'll come to. But it is that fact that they are more at risk for more serious illness and also, sadly, hospitalisation and other serious consequences. So that's why we target older people. And I think it's important to share as well that we don't notice we're getting older. I certainly don't. And but as time goes on, it's part of the reason is that our immune system isn't quite as good as it was when we were younger. And that can creep up on us. So it could be that we had flu when we were in our 30s, 40s, 50s. And yeah, it wasn't very nice, but we were fine. But actually, as we go over 65, get to our 70s and 80s, something that didn't affect us so much when we were younger can be more serious. And I think there's also another issue that we to think of here is that as we get older, we're more likely to have other health conditions.
Indeed.
Yeah, sad but true, but that's the case. And so things like having heart disease, diabetes, or kidney disease, quite common as we get older, but that can also mean that we're more vulnerable to infection and can have more serious illness.
Absolutely. Amen to that, unfortunately. And it is a reality of our life, because sometimes we do not realize how vulnerable us as a human being are, and how susceptible we are to catch all these viruses, and how much sick we can get if we do not look after ourselves. And you are absolutely correct on that. So in terms of vaccines and old people, when we're talking about them, what do we have for them this year? What vaccines they can have this year?
Yep.
I mean, anybody who's 65 plus, because I am getting older as well. It's really not nice thing, but yeah, I can feel it. I can feel the cold and the chills, and it seems like, yes, I'm getting older, which is not nice.
If we had a vaccination to protect our knees, that would be wonderful. My knees have gone. So that's a good question. So what every year, basically, we review, what vaccines are available, who's at risk, what's circulating in the population. And so this year, and part of the winter vaccination campaign, we're talking about 3 vaccinations for older people mostly. So I'll just give the quick introduction to them and go into some more detail. So we've got 2 that are available to anyone that's aged 65 years and older, and that's for flu and for COVID. And then there's a third one, which is part of a brand new vaccination campaign that's rolling out nationally, and that's for something called RSV. So RSV is slightly different. It's for people aged 75 to 80. So it's a slightly different age group.
And it's not RSVP.
It's not RSVP. And I will be honest, and I will say that it's an acronym. It has words. I can't pronounce one of them. So Hannah's but she's much better than me. So it's also, that program is for older people, but it's also covering pregnant women as well. So Hannah will speak about that a bit later.
Definitely, we will catch about that one after the break. But then before the break, let's pick all the other sections up, because for me, it's a bit kind of a. When you say RSV, I have no idea what it is. So I'm sure majority of people do not know anything about it. So definitely I want to know a bit more about that. But let's talk about this side. So you mentioned about old people, and you said what vaccines you're covering for them?
Yeah. So if we start with like flu and COVID, so that's an annual vaccination offer. And the reason we offer it every single winter is both of those illnesses are respiratory illnesses, so they affect your lungs. And they tend to peak around January, so right in the middle of winter. So that's why we start the vaccination offer just before the winter season arrives. But as you said earlier on, it's arrived. It's
Unfortunately.
cold. Yeah. So, and part of that is the reason that the numbers go so high, so more people are affected by these infections, and also, unfortunately, more people end up in hospital with them. Part of that is because we're in the household more. We spend more time at home. We spend more time in close contact with other people. And particularly if you're an older person, but you've got members of your household who might be at school, who might be going out to work, they can go out and about and then potentially bring these bugs back. So they're the two, that's flu and COVID. And also one thing to mention is one of the reasons we offer it every year is because the actual viruses themselves change a little bit. So every year they look at, okay, what's doing the rounds, and tweak the vaccine to make sure that you're best protected against what's around.
Okay, so in terms of these two vaccines, and you just mentioned about the youngsters as well. So is there any special vaccines for youngsters as well, or not?
In terms of younger adults, yeah, so absolutely. And that's a really great question, because whilst we've been talking about older people, 65 and above, actually any adult that has certain what we'd call like long-term health conditions could potentially be at risk again of having more serious illness. So anyone that's under 65, so any adult who's got by long-term health conditions, we're thinking mostly around, there's a long list, so this is not an exhaustive list, it's just some examples. Anything that affects your lungs, so if you happen to have asthma that needs steroids or an inhaler, if you've got COPD, which is chronic obstructive pulmonary disease, or if you've got cystic fibrosis, that can put you at extra risk, but also things like heart disease, diabetes, certain liver conditions, and also being very overweight can put you at more risk of serious infection.
Seriously, obesity?
Yeah, obesity as well. So wow. It's quite important, and it's very important to say I can't cover all of the long-term conditions that make people eligible for free flu and COVID vaccine, but we're sharing information on your website that can link to the trusted NHS resources, but also to encourage people to speak to their GP or their specialist and find out if that's suitable for them, if that's something they'd benefit from. Because importantly to flag is we know that uptake in this particular group, so that's just any adult with a long-term condition, isn't that great. So anything we can do to encourage people, they might not know that they're potentially at increased risk. They might not know that they're eligible for this free vaccine. So anything we can do to encourage people to find out what they're entitled to would be great. So thank you for that question.
Wow. Okay. So I know during the winter season, people normally get ill, and sometimes we look after them. And especially when they are slightly older generations, 65 plus, our grandmothers, our mothers, our uncles, aunties, dads, elder brothers, sisters. So sometimes those older people being looked after by younger people or youngsters or some younger carers. So do they get vaccines? Or is there something for those carers who are looking after those old people?
Absolutely, because people who are what we'd call informal carers, exactly that. It's your helping out a family member or a friend who couldn't cope without you, for various reasons. They could have disability, they could just have health problems, or just through old age. Those informal carers are really important to protect them as well. So actually, if you are a carer, you are eligible for a free flu vaccine. And that's to help protect the person that you're looking after, because they might be vulnerable. And again, the whole point is they might be more at risk of serious illness if they picked up a flu infection, for example. But it's also to look after yourself, because we know that carers can sometimes have poorer health outcomes because it's very busy and it's very difficult to be a carer sometimes.
Indeed.
So it's kind of to support them, to keep them well, and also to keep them able to keep supporting their family member or their friend. Yeah.
Yes, indeed. And these are the things. These are the people who are unsung heroes, who normally they themselves do not know that they are caring for it, because in our culture, in people from subcontinental culture, elders are elders, and they are part of the family. They are part of they are the part of the main beam of the family, the main roots of the family. So we look after them without thinking that we are caring for them. And those are the ones who sometimes don't realize they're passing those bugs, just like you mentioned earlier, that kids coming to the school, coming back with the bugs, infecting our older generation. And yes, that's why we need to make sure that they are properly protected. On that note, let me introduce our listeners as well and see what they have to say. Listeners, if you have any questions or queries regarding our show tonight, which is winter vaccinations, please give us a call on 01582 481822. I repeat, 01582 481822. Or you can send your questions via text messages or WhatsApp on 0779 481822. I repeat, 0779 481822. You can also send email, or you can also send messages or on our Facebook or YouTube channels as well on a live link, and we will definitely ask those questions to our two lovely guests who are with us in the studio. Now, when we are talking about carers, do you have any experiences in this matter of getting the flu jab as a carer? Either one of you?
Yeah, I do. I do, actually. So actually, just before COVID lockdown, my dad took poorly and he moved in with me for care. So he wasn't able to look after himself at home anymore. So my dad had a physical disability, but he also had a number of other health conditions. So like we were saying about the risk groups, people that are more at risk of having serious illness. So Dad had severe asthma, he had COPD, and then as he was living with me, he was diagnosed with cancer and started cancer treatment as well. So he had quite a kit and caboodle of making him a bit more vulnerable to infection. So I was his informal carer, and so exactly like you're saying, got first-hand experience of, you love your father, you respect your father, and you want to care for him, but it can be exhausting. So in my role as the carer, it was getting him up in the morning, preparing his meals, helping him eat, washing him, dressing him, getting him into the wheelchair. But really importantly as well, he had so many health conditions, it was driving him around to all his different appointments whilst working as well. So being aware that I was out and about at some points, and kind of being careful about what I might be bringing home. So as part of that, I was always really conscious about any infections that I could give him. So it was like lots of all the good infection control stuff, making sure you wash your hands, particularly if you're about to prepare a meal, that sort of thing. And actually, again, always aware of the fact he had what we'd call a weak chest, because his lungs weren't great. And actually, I was out at our community pharmacy and just picking up his endless bags of pills. And there was a poster up, actually, that was advertising the flu vaccine and for carers. So I spoke to the pharmacist and found out then that, yes, as his carer, this was available to me to help protect him from any infection, but also to keep me well as well, so I could keep looking after him. So booked my flu vaccine, got it done locally, and it was really nice. I was really yeah, it was a good feeling actually that it was an extra step I could take to try and keep him safe. So.
But not only that, being a healthcare worker working in NHS, that gives you also some kind of a protection, because you normally they normally ask all their employees to have a flu vaccination, COVID vaccination, isn't it?
Yes, we do definitely. The NHS does recommend that healthcare professionals and also people that work in care homes get vaccinated against flu and COVID. Yeah.
And I was going to say as well, when we were talking about Louise's experience of being a carer, she told me something I didn't know, which is that you can actually register yourself as a carer with your GP. Because one of the things we were going to say is for a lot of these vaccinations, hopefully people will have been invited by their GP. So if you're over 65, if you're a known carer, they hopefully have invited you by now. But if you haven't gone to your appointment for whatever reason, if you couldn't make up your mind, if you just haven't been able to get round to it, I suppose one of the things we wanted to say is it's not too late. Now is a brilliant time. If you haven't responded to that invitation to come in, now's the time to go in, have the vaccination just while the weather's turning cold in the run up to the sort of holiday season. And yeah, maybe to register as a carer so that they'll know in the future to invite you in future years.
Yes, indeed. And for our listeners, if you really want to have a vaccine, and yes, you think that you are in those vulnerable group, you have a health condition or long-term health conditions, and or you are a carer of a person, an elder person in the family, you can always go to the NHS England website or .gov website and go and book yourself an appointment with your nearest vaccination centers, and that could be your GP surgery. I know it's not easy to get an appointment in GP surgeries for anything. So pharmacies are available. They're in Luton. They are pretty much out. Other than a handful of pharmacies, all pharmacies are offering flu vaccinations, COVID vaccinations. You can have that, and it is nice to have those vaccines because it provides the necessary cover, isn't it?
Yeah. And obviously they're free. If you're eligible, all those vaccines are free, which is great as well. And you don't even need to be registered with a GP. You could just go to the pharmacy and yeah, they'll, like you say, they'll see you there, and it's a really convenient way to do it.
Mm-hmm. Indeed. Before wow, the time has passed quickly. I just have under 3 minutes before we hit the breaks or hit the go on a commercial break. I just need to ask you, what is RSV stands for, Hannah? Because I know throughout the first half hour, I have Louise with me speaking about these things. I have not spoken to you, so give us a bit kind of an intro on what RSV is, and it's nothing to do with RSVP, which we normally see on different places, and why is it important before we go on break, and then when we come back from the break, we will talk a bit more about that.
Yep. So RSV is respiratory syncytial virus, which is quite hard to say, which is why we usually just say RSV. And yeah, so it's a respiratory virus, so it causes inflammation of the airways, bronchiolitis, so it can cause difficulty breathing. And yeah, it's strange because it's a very common bug, but actually a lot of people have never heard of it. And yeah, this is the first year that a vaccine has been available in this country to protect against RSV. So yeah, and it can cause severe illness in older people and small babies. So it's really exciting actually to be able to hopefully prevent a lot of cases of breathing difficulties this winter.
And who can have these vaccines, these RSV vaccines?
So RSV is targeted at 75 to 80-year-olds on the older age group, and then is being offered to pregnant women from 28 weeks of pregnancy, with the idea that it protects the baby when the baby's first born. So yeah, we're really hoping to see a lot fewer babies being admitted to hospital, for example, this winter because of the vaccine.
All right, okay. And what about people who have severe asthma, who normally get a very uncontrollable asthma, especially during the winter, and they end up utilizing their rescue packs?
Yeah, so for them, RSV isn't available for those groups at the moment, but I think for those people, definitely flu, COVID, those would be really good ones and important for those groups to get.
Mm-hmm. Indeed, and I will touch on this topic a bit more once we come back from the break. So as we are going on a break, do stay tuned. When we come back from the break, we will talk a bit more about RSV. We will ask why flu and COVID vaccines are important. Is there any stuff available in those ones? Because that's one of the biggest problems. What we can do about the kids' vaccinations as well, and are vaccines safe? Because majority of the people still believe the vaccines are not safe. This and much more after the break.
This program will continue after the break. Continue listening to Inspire FM. Inspire 105.1 FM.
This Christmas, there will be millions of songs streamed, movies watched, and job searches online. But around 2 million households are living in data poverty, disconnected from the essentials they need to get by. So we're giving away free data to those who need it most. If you're struggling, ask for the National Data Bank in any O2 store. O2, see what you can do.
SIM available in store on National Data Bank, subject to availability. Minimum 25 gig, 18 plus. Terms apply. See o2.co.uk.
Established since 1990, Lee Grave Heating Supplies is the largest independent plumbers merchant in the area. And we're the specialist for all types of plumbing and heating, as well as combination boilers and mega flow cylinders. Lee Grave Heating Supplies is your first choice for your new bathroom or complete heating system. Visit our showroom at Shoreland Lane, Luton to see our latest range of quality bathrooms. Or log on to lhsdirect.co.uk. We're stockists of genuine Baxi spares, and we have a showroom in Bedford too. Lee Grave Heating Supplies. Call Luton 84 86 88.
Are you thinking of starting a podcast or looking to give your podcast a new home? Why not hire Inspire FM's dedicated recording studio? With rates starting at just £25 per booking, our podcast studio is a fully functional, acoustically treated space for up to 4 people, and it's set up and ready to use as soon as you arrive. For more information or to inquire about booking, email us at info@inspirefm.org or send us a DM on our social media accounts at InspireFM Luton.
السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. قال النبي صلى الله عليه وسلم: من يحرم الرفق يحرم الخير. That whoever is deprived of gentleness is deprived of good.
Do you have a legal problem? Are you trying to settle a family member? If so, then contact M&K Solicitors. M&K Solicitors are a leading local firm specializing in immigration, family, personal injury, clinical negligence, civil and property law. Our solicitors have over 20 years' experience and are recognized internationally. Our success rate speaks for itself. Take advantage of our free consultations for your first meeting. We also give free advice on Fridays, no appointment needed. That's right, free legal advice. M&K Solicitors. Call 01582 732 503.
With UK Export Finance, I'm fulfilling more export orders from around the world with working capital support.
Export insurance means I'll get paid when exporting to challenging markets.
At UK Export Finance, we believe no viable UK export should fail for lack of finance or insurance. Between 2023 and 2024, we provided £8.8 billion of government-backed trade finance to support UK exports. Learn how we could help you win export contracts, fulfill orders, and get paid. Search UK Export Finance today.
اقرأ باسم ربك الذي خلق.
Tune in to Inspired by the Quran, a new show on Inspire FM where we discover and reflect on the lessons given to us by the Holy Quran. Join me, Husam, as we travel through the verses of Revelation, listen to beautiful nasheeds and reflect on stories of faith and wisdom. Tune in every weekday from 4 p.m. on Inspire 105.1 FM, inspirefm.org or the Inspire FM app.
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and good evening to our listeners and viewers. Welcome back to the Health and Fitness Show. I'm Fahad Matin, your host for this evening, and today we are talking about winter vaccinations with our two lovely guests, Hannah Roscoe and Louise Catling from NHS England National National Screening and Immunisation Team. This program is broadcasting live from the studios of Inspire FM today on 21st of November 2024, and the time just past 6:30. We are doing this from the studios of Inspire FM for our lovely people in Luton and all the surrounding areas of Luton like Dunstable, Harpenden and Bedford. Our positive airways reaching out to everybody through our Inspire FM radio station. We are beaming out through our Inspire FM app, website, and you can view us via a live link of Facebook and YouTube channels. So good evening and welcome back. So before we went on break, we were talking about RSV vaccines and how can people get them, get those vaccines. So Hannah, you mentioned that the RSV vaccines are for people who are 60 to 70 years.
75 to 80.
75 to 80 year old, and is there and the people who are pregnant and
That's
they're
right.
28 weeks.
Yeah.
So why this specific age group? Why not everybody?
So, yeah, the decisions about who gets the vaccines are made by a national committee, and they review evidence about who is the worst affected by the particular disease and therefore who's most likely to benefit from the vaccine.
Mm-hmm.
And what we see with RSV is it does cause the worst illness in older people, so 75 and above, and in very young babies. So that's why we're offering to pregnant women. It's more so the woman builds up immunity and it passes to the baby to protect them when they're very small.
Mm-hmm.
So, yeah, that's a decision that's been based on the evidence. And, yeah, we were just saying in the break, obviously that committee, they review the evidence all the time and keep an eye if they need to make any changes. But that's, yeah, what they've the guidance that we've had for this year.
Yes, indeed. And sometimes it's really hard because as we were discussing during the break, there are people who definitely heard about this vaccine and they said, yes, they want it. And then there are people who are really, really anti about those vaccines. So when we're talking about vaccines itself, or do flu, COVID, RSV vaccines contain pork gelatins? Because this is one of the very common thing which people again and again ask. I know it's still in my family. They ask, are these vaccines safe? Do they have pork in it? Pork contents in it? And it's really hard. So what do you guys say?
So for all the vaccines that we're talking about today that are for adults, so flu, COVID, RSV, none of those have pork products in, which is great. And on the safety front, as you'd imagine, they've all been extensively safety tested, and all of those vaccines have now been used in thousands of people. So the only vaccine where there are pork products is, so for children, the flu vaccine that they get is a nasal spray, and that has some pork gelatin in to enable it to be sprayed in the nose. But if you would prefer for your child to not have that vaccine, they can have the injection as an alternative, and then there's no pork in that.
Yes, I know. I remember that because I was one of those few people who have voiced out, and we are lucky. We as a Luton lucky that we managed to run successful pilot runs in Luton and have shown in the national conferences that from 18% uptake to 45% uptake can be achieved if you trust people, and if you get the confidence of the people that yes, it is safe for your kids and it does not have any derivatives which can have any allergic reactions or can go against your belief. And yes, these things do help a lot, and we are very much lucky in that sense.
I'd just like to jump in on that point where you mentioned allergies. That is really important. So we know with the vaccines, as Hannah said, they're extensively safety tested. They're tested in multiple population groups to make sure they're safe, including pregnant women and children. But obviously any vaccine there is the risk of side effects. So we'll talk about side effects maybe a bit later, mostly mild. But because you mentioned allergies, some people do have severe allergies. And then it's possible then for people to have it's a very rare side effect. And most people are actually aware that they have allergies, and would have talked it through, and the healthcare provider is aware as well. So it's just to say that if you do have a severe allergy and you know this, and your GP should know this as well, then that's kind of having that conversation about whether that vaccine's safe for you.
Indeed. And these are the things which we have to look after ourselves. And sometimes all we have to do is just make sure that if we are going to have these vaccines either at our GP practice or at our pharmacies, we inform them that, look, these are the problems which we have. Is the vaccine safe enough for people who I know a few people who have eggs allergies, and they make sure that they do not have any kind of reactions after having flu vaccines after having. So yes, it is very, very, very correct. Now coming back to the pregnant women, I know you mentioned in the section that pregnant women have RSV available for them. What else pregnant women can have during this winter?
Yeah, so there's 3 vaccines that are being recommended for pregnant women this winter. So firstly, there's flu. So obviously we talk quite a lot about flu. Again, we can be a bit blasé about flu and think, it's just a cold. But actually, when you're pregnant, it does affect your immune system. Mm-hmm. So you, as the mum, are more likely to get severe illness. But also it can affect the baby. So it can lead to things like having a low birth weight, being born early, or even, unfortunately, stillbirth. So it is really important to have the flu jab if you're pregnant. You can have it at any point in your pregnancy. And as we were saying, this is a great time of year to get the jab ahead of, when you start mingling with people over the holiday season, the weather getting really cold. Exactly. Indeed. So, yeah, we definitely recommend flu. The other one is a jab for whooping cough, which is also known as pertussis. So that is another bug that can be very, very serious in young babies. Mm-hmm. So that's why we offer the vaccine to the mum. The mum builds up immunity and it passes to the baby, and it helps to just protect the baby until they're old enough to have their own first set of vaccinations at 8 weeks. Mm-hmm. So usually a whooping cough vaccine is offered from 16 weeks of pregnancy, but it would be usually around the time of your 20-week scan. But if you're past that stage of your pregnancy, again, it's not too late. It's worth having right up until the point of delivery. So if you think you might have missed that jab, do just have a chat to your midwife or your GP. And you would need it even if you've already had the whooping cough vaccine in another pregnancy, or maybe when you were a child. You need to have a new one every time, just to build up that immunity to pass to the baby.
Because one of the things which I'm very, very worried about, and it's not just me, anybody who has gone through these things during pregnancy, pretty much any medical advice it's really hard to give, because they are not allowed to have pretty much any medication whatsoever other than paracetamol. Because I remember when my missus was not well, she was pregnant. I went to the pharmacist, can I have this? And the person said, is she pregnant? I said, yeah. And I was always worried about that. So coming to the point, I know when you hear this message again and again that you cannot have anything whatsoever during pregnancy, people always think, are vaccines safe to get in pregnancy? Can a pregnant woman have a vaccine? Because I remember during COVID times when I was running a COVID center, when I see some pregnant women in the queue, I was worried, and I asked them, are you okay to have this vaccine? And they said, yeah, we wanted to have. So are vaccines safe for pregnant women?
I think that's such a great question, and you're so right. I think when you're pregnant, you're just hyper aware, aren't you, of any of those decisions. But I think, like we were saying, any vaccine that's recommended by the NHS has been very, very extensively tested for safety, and it will have been tested on pregnant women and shown to be safe. There's ongoing monitoring through something called the Yellow Card Scheme. But yeah, all of these vaccines, so obviously flu and whooping cough have been around for a very long time, those vaccines, and have been given to thousands of women with a very, very good safety profile. And then obviously RSV is new here, but it has been used a lot in the United States, and again has been shown to be very safe. So yeah, I absolutely, as you can imagine, as a public health person, when I was pregnant myself, did a lot of research, and yeah, I found all of that very reassuring, that they have gone through such a stringent, robust safety testing process, and they've been used in hundreds of thousands of women, and actually they're very safe, and they do really help to protect the mums and the babies in those early months when babies are so small and they need that protection.
So let's talk about babies itself. So you mentioned that the reason of giving RSV vaccine to pregnant women is for that vaccine's immunity can be passed to a baby. So can an RSV vaccine given to a baby itself?
No, so the vaccine isn't suitable for giving directly to the baby. So that's why it's being offered to the mum, exactly. And then so the mum builds up the immunity and passes it through the placenta to the baby, which is pretty amazing.
And you said you were pregnant recently. So have you had any experience of having that pass through?
No, I've got two little girls who are 4 and 1. So I missed this RSV vaccination program, which was such a shame, because one of my daughters actually had RSV as a small baby. And I really wish that we'd have had the vaccine, because it was a really scary experience, because she was 2 months old, and one day we noticed that she was really struggling to breathe, and kind of drawing her tummy in, like babies do when they can't breathe very well. Called 111 for some advice, and literally within minutes an ambulance was at our door, and there were paramedics in our house, and we got blue lighted to the hospital, because obviously when babies are so small, their airways are so small, they take it very, very seriously.
Indeed.
Yeah, and so I was a first-time mum, absolutely scared out of my wits. And actually it turned out, we got to the hospital, she was assessed, and we got sent home not that long after. But sometimes babies do have to go into intensive care and get some quite, treatment that you don't want to see your baby intubated and tubes and wires everywhere. So I'm so glad that the RSV vaccine is available now, and other people won't have that experience, because it's obviously horrible for your baby, and it's horrible for you as new parents to see your tiny baby in that situation.
Indeed. And in terms of things like RSV and whooping cough, if somebody past that age of pregnancy or passed out, they just delivered, can they still have those vaccines or no?
I think if you've already delivered your baby, probably
no,
it's a bit too late. But any time up to delivery, so again, it's not too late. And obviously, it's not that long. 8 weeks is the first set of immunisations for your baby. So it's, you can still take the opportunity to review, think about what might be available to you, to other people, and decide if you want to accept those vaccinations.
So coming to the topic of kids and vaccines, and I know there are people who really want to know what vaccines they can give to their kids, because that's another thing. Being a parent, we normally make sure our kids are immunized and they are well protected, whether we can have it or not, and that's like a parently feeling which I always have. So what winter vaccines should children and young people be getting this winter?
Yep. So in terms of winter vaccines for children, it's mainly flu. So if your child is aged between 2 and 18, they're eligible for the flu vaccine. So if your child is at school, they will have been offered the vaccine through their school, and hopefully they would have got it. But again, if they missed it for some reason, or you weren't sure and you didn't give consent, it's not too late. You can talk to your GP. They'll get in contact with the school age immunisation service, and you might be able to. They have catch-up clinics happening all around the region, so they might be able to go to a catch-up clinic if you've got a 2 or a 3-year-old, hopefully you'd have been invited by your GP for the flu vaccine. Same again, if you've missed it, if you were undecided, it's like we were saying earlier, this group, so children and young people, they get flu a lot. So 5 to 14-year-olds get it twice as much as any other age group. They're really good at passing it on. So they don't often get very severe illness themselves. But obviously, you know what kids are like. They love...
Indeed. And unfortunately, that's what it is. Because kids, they like experimenting things. They like interacting with people. So between their kids themselves, they share everything, not like us. They share anything and everything, including bugs.
Exactly.
Yeah, that's exactly links to what we were talking about before the break as well with older people. So they'll go around, they'll see their grandparents, their aunties, their uncles. It's all hugs, kisses, and flu.
Yes, exactly. A few of my friends, they are just unwell because they just had a recent visit from their grandkids or their nieces and nephews, and then next thing you know, they're not well.
I can relate to that with my nieces.
Exactly. So in terms of children with health conditions, and that's where it goes serious. Like you said, your daughter has RSV in the early ages. So kids who or young adults who have health conditions, is flu vaccine safe for them? Because that's another thing which most parents do worried, that my child is not well, why should I give flu? Or do my child need a vaccination for COVID vaccinations, this, that, another? And it is a very common thing, or thing normally people think of.
Absolutely. So I think if you've got a child who has a health condition, not only is the flu vaccine safe, but actually they would probably benefit even more than your average child, because they're more at risk of developing that severe illness. And actually, if you have a child who has an underlying health condition, so for example, they might be under a specialist hospital care, so things like if they've got a heart problem that they've had from birth, or very, very serious asthma, something like that, they can actually get the flu vaccine from 6 months old. And that 6 month to 2 year age group, again, the uptake in that group is quite low, because I think people just don't know that such small children can have the flu vaccine, but they definitely can. And we'd really recommend it, because obviously they are at risk from getting that serious illness. So it's, if you think that your child might be in that category and you haven't heard from your GP, do just drop them a line, go in and see them and just check, because you may well be eligible for the flu vaccine for your child.
Indeed. And you mentioned about side effects earlier. What are the side effects of these vaccines? And I'm talking about all three vaccines, which is flu, COVID, and RSV for adults and youngsters.
Yeah, so I think lots of people do worry about side effects. So, but I think as Hannah was saying, it's been extensively tested, lots of huge studies with lots and lots of people. And the vast majority of any side effects, if they happen at all, are very mild. So commonly, if you've had it by injection, it can be like soreness, muscle ache in the arm, say the way you've had the injection, maybe a bit of redness. Some people can have a bit of a headache. And it can vary by which vaccine it is, sometimes maybe a little bit of a temperature, but very mild and will resolve. And I think the advice is, so children as well can have some of these side effects, but I think actually one of the bits of advice I saw is a good cuddle, and within a day or two they'll be feeling fine. And it's, I think we do have to acknowledge that, whilst the vast majority of people, if anything, it's mild, there can be very, very, very rarely serious side effects. And mostly that would be around, like we said earlier, allergic reactions. So hopefully if people have been diagnosed with a severe allergy, they're aware of it. They can already talk to their healthcare provider about it to find out if it's that vaccine suitable for them. But the thing to note with that is, even though it's incredibly rare, so I really want to reassure people, it does not happen often, but it happens very quickly. And everyone who administers vaccines are trained how to deal with that. So I think it wouldn't be right to say there are no side effects. But the thing is to realize it's that balance of benefits. So it's the science shows, the studies show that it really can reduce your risk of severe illness and sadly severe consequences. So for example, with RSV, we know that it's about 30,000 babies every year in the UK that get hospitalised, and sadly there are about 20 or 30 deaths every year. So again, it's these vaccines are safe, they're effective, and they're one of the best tools we've got for fighting infectious diseases.
Indeed. And I just received a message on the screen from one of our listeners. And sorry, listeners, I did not involve you earlier. So, listeners, if you have any questions or queries regarding our topic, please get in touch with us, although we just have 5 minutes remaining for the show to end. So the question says, I have I have flu vaccine. And I got flu-like symptoms. Why?
Fair question. I suppose the question would be, if you got flu-like symptoms pretty quickly after your vaccine, so say within a day or two, and those flu-like symptoms, obviously, without any more detail, we can assume maybe a bit of a headache, maybe a bit of a temperature, feeling a bit shivery. That could be part of just your body's immune response, you know. So like we said, that would be a mild side effect, but that's a sign. If it's that case, that's a sign that your body is, you know, it's producing the antibodies. That's what happens when we get that vaccine. It's teaching our body to recognize something that's bad for us, basically. So we get an immune response, we build antibodies. So if we come across that bug again, we're armed and we're prepared for it. But again, to note that the flu vaccine, it won't necessarily stop you getting flu. So say you got these symptoms, I don't know, maybe a month later. It won't necessarily stop you getting flu, but what it does do is it makes sure that any infection you have is milder than it would have been. So your symptoms are milder and actually you can recover faster, which is super important. We're talking about these risk groups.
Indeed.
Yeah.
And with the flu, I remember one of the GPs was saying that the easiest way of understanding it's flu and not cold is that if you can see a 10-pound note right at the doorstep and you're lying on the bed, if you can get up from your bed, go to that 10-pound note, and you bend down and pick it up and go back to your bed, that means you do not have flu. You have a mild colon and bit kind of a achy body. And
that is a fantastic way of describing the difference between flu and a cold.
Exactly. So it's on that note, I must say the time has passed really, really quickly. We just have under 3 minutes before the end of the show. So I'd just like to know what would be the overall message about winter vaccinations, if you can sum up in a few words, and a positive message for our listeners. Let's start with you, Hannah.
Yeah, so I think I'd just say, vaccines can really help to protect you and your family over the winter. And if you've been invited and you haven't gone, it's not too late. Now is a perfect time to arrange for those vaccinations. If you're eligible, they're free. So do speak to your GP, speak to a pharmacist, look on the NHS website. And that it's a really good way to protect the whole family and stop those bugs getting in and ruining your holiday season.
Indeed.
And for me to wrap up as well, it's just recognizing, exactly echoing what Hannah says, best way to protect ourselves and our family, but also being mindful of, if we've got family members who might be in these risk groups, who might be older, might have these health conditions we've been talking about, to let them know, it could be your mum, your dad, your brother, your sister, your auntie, your uncle, but to share this information with them. And also, if you want more information, to use real trusted sources. So the NHS will only ever publish on its website very, very good evidence-based information, and they always review it. So we'll be sharing the links with yourself to put on your Facebook page. So just for more information, go to a real trusted source, either the NHS or the WHO, World Health Organization.
Indeed. And that's how we can look after us and our loved ones. Because as I said earlier in the beginning of the show, this winter or any winter, we normally cover ourselves, keep ourselves healthy, keep ourselves hydrated, keep ourselves warm. Why not keep ourselves vaccinated at the same time? Because it does make sense. You look after your body will look after you. Simple.
Well said.
Simple. And that's what it is. That's what it is. And that's how we make sure we are looking after ourselves, our elder generations, our youngsters, from any age to all age. And you mentioned that people who are school-going age can have their vaccines from their schools, correct?
Yep. So in a lot of schools, it's already happened. But if you think you might have missed it, then do speak to your GP.
Exactly. And there are catch-up clinics going through. You may be receiving some messages from your schools, either by email or by whichever way your school communicates to you, whether you are in the junior schools, primary schools, or secondary schools. On that note, I must say thank you so much to both Hannah and Louise for coming to our show, for doing a brilliant show with us, and sharing and spreading beautiful knowledge with all our listeners. They're here for the very first time, and I'm sure that it's not their last time. They will be seeing again and again to them.
Thank you so much for having us. It's been lovely to be here. Thank you.
Thank you. And that's all for tonight, guys. We will be meeting again next week, or with a brand new topic, with a brand new guest. And all we have to ask you is, do remember us in your duas. And do look after yourself. Keep yourself safe. Keep yourself healthy, because that's more important than anything else. Stay tuned. Fahad Matin, Assalamu alaikum. Signing off. Assalamu alaikum.